Hi, I'm Angela from Parker Center for Plastic Surgery. I'm here with Karen, who is a patient of ours, and Dr. Parker, and we're going to talk a little bit about Karen's experience here at the Parker Center. So Karen has 4 children, and we did a tummy tuck with some liposuction of her hips back just in May, and she looks fabulous. She's a recurring patient. 18 years ago, we did a breast augmentation on her, so we like when our patients come back to see us. So Karen, you want to tell us a little bit about your experience here for the tummy tuck this time?
Yes, I will start with when I was convinced that it was time to do the tummy tuck. I was like, oh, but that's gonna take a lot of downtime. I didn't think I had the time. I have my little one still at home and busy at work. So I said, okay, I can't do this. So then in conversation with other family and friends who have been through the procedure, I asked, what do you think? Should I do it? And they said, now is the time, go ahead and do it. So I decided to call Dr. Parker. They fit me in their schedule. And the moment I walked in, it was just like my first experience. You walk in, the office is super glamorous and clean and neat. And so I felt comfortable right away. The staff greeted me, provided me immediate information. And then when I met with the nurses and I addressed my concerns on how the downtime was a really big component to me, they started going through the procedures on what my options were. And then I met with Dr. Parker and I was sold. That was it. It was time to do the procedure.
So Karen, you want to talk a little bit about the recovery, your experience here down in our surgery center, and then the recovery afterwards?
Yes, so the recovery started downstairs, and I would say it was a really life-changing event. And the reason why I describe it that way is because the nurse, when I woke up, she said, look down. And I looked down and I was immediately filled with so much happiness because I saw immediate results. Like you immediately, exactly, it's gone. And I was just so excited, and I knew, I'm like, okay, we're here to start. And I was able to just walk away with like, I'm so glad I did this. So it was, from the beginning, it was great. Then when I got home, I had all my medications and vitamins that I needed to take. I kept it together. And I knew that as soon as I got home, I'm like, okay, this is where we're gonna get started. We're gonna recover, we're gonna get through this. And all of the advice that I received from the nurses, the staff, the doctors, even the anesthesiologist gave me advice. I knew, I'm like, okay, I'm gonna take all of that into account so that we can really take advantage of the fast and rapid recovery that you have already implemented with all the procedures. So that was very important to me to start that way.
Part of the rapid recovery, Dr. Parker can speak a little bit more about their rapid recovery program that we have, but it's really helpful.
It is.
And it does help you heal a little quicker.
Mm-hmm.
Yeah, it's something we put together over the years in conjunction with the anesthesiologist. Medications we give before, during, and after, as well as 3 post-op manual and lymphatic drainage massages to try to make the recovery as quick and easy for patients as possible.
Mm-hmm.
Obviously, tummy tucks are traditionally a tough recovery, so we want that to be as little as an impediment for patients so they can move forward and enjoy the result like you. I think it's really helpful though with a patient like Karen because she's a wonderful patient. And what I mean by that is, as you can probably tell, she's a very nice lady. She's very well spoken, but she really prepares very well. She listens to what we said and she implemented it. And that's an important part of the battle. We can kind of lay things out, we can do our pre-op education session, but then to have such a good patient like Karen who follows everything to the letter and with a high level of compliance, I think in part that's why the recovery was as great as it was.
Yeah, and I do want to mention that I actually did review the instructions several times just to be sure that I had everything in place. And I made notes. Everything, the advice that everyone gave me amongst the staff, the nurses, and the doctors, I made note of that because I knew that everyone's experience would help with my experience. So I would have to say that I really appreciate the opportunity to sit and meet with everyone, and everyone had such great advice, and that helped me with my journey for sure.
Talk about the first few days, because that can typically be the most difficult for patients. We give the medications, we inject a long-acting anesthetic during the surgery, but talk about what it was like and maybe reference your C-section experience.
So the first, as I mentioned, when I woke up, it was just really great feeling to see that it was all gone. And when I went home, because I had prepped a little bit based on the instructions that I had, day one, I would say you're tired. You're coming off of anesthesia. you rather rest, but it's very important. You have to take your medication. You want to follow the regimen because you don't want to interrupt the schedule. That's very important. I did rest day 1. Day 2, I truly was expecting to wake up in excruciating pain. And when I woke up, I didn't feel anything. I really didn't.
Which is really important because we need you up, we need you
Yes,
moving. We can't have you
exactly, exactly.
So that's important.
Yes, and day
Yeah.
1, I was advised, take a few steps, obviously listen to your body as best as you can, but I did walk. I walked to the restroom and back and to the couch and back, but day 1 I rested most of the day. Day 2, as I described, I didn't wake up with much pain. I was able to walk around, and as recommended, I even showered. So that was important. It made me feel a lot better. A lot better.
For sure.
And I would say day 2, I was a lot more mobile because I wasn't as sleepy and tired. I would say that day 2, I was just curious as to when is the anesthetic gonna wear off. That's what I was worried. I was like waiting for that pain because I'll never forget with my C-section, I woke up the next day and I was in excruciating pain. I couldn't even move around. I was afraid to sneeze. I couldn't get out of bed. I didn't even want to shower. It was just so difficult to recover from
There's
that.
a lot more going on with a C-section than there is with this also.
Exactly.
So you have muscle being cut, your uterus is contracted.
Exactly.
So there's a lot more going on.
Yeah, definitely.
Especially you have a baby to take care of.
Exactly. You're tired, you're nursing. So very, very different experience. But I share that because I thought that it was going to be worse. So that's why in the back of my head, I was wondering, when is it gonna wear off? When is it gonna wear off? And then day 3, I woke up, no pain. And I thought to myself, okay, this is different. I can do this. Day 3, maybe I shouldn't admit this, but I made breakfast for the girls. And so I was able to do that. And I was surprised. I was like, oh, okay, this is not so bad. And then day 4, I would say by day 4, I felt so much better. I was eating, I was able to, I attempted to go down the stairs and I went down the stairs with no pain. And I would say by day 5, I didn't want to stand up straight because I was nervous. I wanted to get the clearance from you guys, but I just felt so much better. I didn't utilize my walker at that point. I was able to take longer walks to and from different rooms, to the restroom. So it was a different experience I would say by day 4 and 5 for sure. Yes.
And Karen's a month post-operatively now. So tell us, I mean, you're still losing some swelling, but you have a sense based on how you looked that first day and then what's evolved over the past month. Just share with everybody your sense of body image, how you feel about yourself, self-confidence, and those kind of things, which are often affected significantly by this.
Yeah, so I will share, and I have been telling my story to everyone who will listen. It's such a euphoric feeling to feel so good. And even right after surgery, I was happy. If that was the result, I would have been, I was happy. A week later, when I came in and I saw in the long mirror, I was like, oh my goodness. And then as the days go on, it's just such a wonderful feeling just to look at yourself and to try on clothes that you never thought you would fit into again, and they do. It's just a fantastic feeling. I'm trying to share it's such a euphoric feeling that I've been describing to all the women and friends. I'm like, do it. If you're interested in doing something, do it. Just have a consultation with Dr. Parker, speak to nurses. You'll be surprised on how something so small or maybe a big procedure that you want to do will just give you such a good pep in your step. And day to day, honestly, I just feel so much more confident to walk into a room, feel so great, not worried about how my clothes are fitting. It's just a wonderful, wonderful feeling. And I wish this feeling to everyone. I really generally do. It's such a great feeling.
Well, one of the reasons we wanted to talk with you is that you're such a good patient, such a good historian, and very well spoken. And the patients will frequently come see us after having had children, after having lost a bunch of weight, and they think liposuction alone is the answer. And liposuction oftentimes is part of the solution, particularly with a tummy tuck. But then tightening loose muscle, removing the skin, will give people a wonderful result like you. The impediment is often the concern about pain. Mm-hmm. And so in your mind now, what advice would you give to people when you're weighing the long-term potential gain that you now see versus that short-term pain, and you know, how you kind of dealt with that in your mind going in, and now your perspective after having been through it all.
Yeah, I would say for pain management, I did anticipate, I compared it to a C-section. I was expecting that sort of pain. So I prepped myself with having the available Tylenol on hand. I had it all handy. I actually kept it all together with my other medications post-op. So I kept it all together just in case. And I did call in and I did ask, just in case, can I get something stronger? But it wasn't really necessary because it wasn't as painful as I expected. It was just a little bit uncomfortable in my back for the liposuction, but I did use a cream from my oncologist that allowed me to kind of subside that pain, and I didn't have to take a stronger pain medication that could later lead to constipation and everything else. So I was happy that I didn't have to.
And I think our pain regimen is such that you don't need narcotics.
You don't.
I mean, we give non-narcotic painkillers for the first 7 days. We give muscle relaxants. We give anti-inflammatories. So that whole regimen really does help the pain, especially the first week. So as you know, narcotics cause a lot of side effects that are not fun.
Yes, and that was actually a really important concern for me because I didn't want the side effects because I didn't want to not be able to use the restroom.
And you have a family to really tend to also.
Exactly.
So you want to be there for them.
Exactly.
Yeah, for
yes,
sure.
that was very important.
So Karen, tell us a little bit about your experience here. Did you feel safe? Did you feel comfortable with the staff that we have here? We know from our perspective we have a very safe environment, but it's nice to hear from our patients if there's anything we could do better, or if there was anything that made you feel uncomfortable.
I would say that one thing that stood apart from other centers that I visited or called in and inquired is I felt immediately safe and comfortable because the staff was so knowledgeable. They were welcoming and accepting of all my questions. I may have asked 10 questions, all probably with the same topic, but they all answered. They all had good experience and knowledge of what I was getting myself into, and they were able to direct questions. Maybe they didn't have direct answer, but they knew exactly who would be the perfect person to answer. So that was very important to me, and I felt comfortable and very safe from my first consultation to the day of surgery. I was welcomed immediately, and everyone was knowledgeable and ready and prepped, and most importantly, clean and sanitized. I did not feel. I felt like I was in a facility that if anything was urgent or something happened, I knew that I was in a good place and I was going to be taken care of by, not only because of where I was located, but with the staff so knowledgeable. So that was very important to me.
And I think from Dr. Parker's perspective, it's an environment that he's very comfortable in and very safe, and he's surrounded by the same staff. And if you'd like to talk a little bit about that.
Yeah. Well, we are very proud of our facility here. We've got very good people that I enjoy working with day in and day out in the Parker Center itself, the Parker Center Med Spa, and then Surgiplex, our ambulatory surgical center. And what's nice about it is all under one roof, and everybody is very well integrated. So when we hand the baton off from Parker Center to Surgiplex, and then when the patient's recovering, back to Parker Center and the Med Spa, we try to make the care as continuous and seamless as we possibly can. In Surgiplex per se, we have designed what we think is a very safe center. Our anesthesiologists are great. I assume your anesthesia was good. It typically is.
Perfect.
Yeah.
It was perfect.
Yeah, so anesthesiologist great, and the staff is just they're smart, nurturing people who I think take very good care of our patients, and we abide by what we call a culture of safety, where patients are our priority to get through the procedure well and safely, and then make the recovery as much of a non-issue as possible.
I will also add that the staff was so warm and I didn't feel as a patient. I felt like they were welcoming me
Family.
as a family, yes. They were really, really attentive to my needs and even my concerns. And they would follow up as soon as I walked in, they'll follow up with a concern I've just had. So that was very different. I wasn't just a patient coming in and getting a procedure done.
It's one patient at a time.
Exactly.
That we take care of. So,
Absolutely. And that is
you're the
definitely
main reason why we're all down there and taking care of you. So it's really important. And we follow all the state regulations. We're licensed by the state of New Jersey. We're accredited by Medicare. So we go through all of the inspections and we follow all the guidelines that the hospital does. So we don't take any chances here in our facility. And we've had surgery here. I personally trust the anesthesiologist with my life. I think they're amazing. And our staff has had surgery down there. Our staff's family has had surgery down there. So that says a lot about the safety of our surgery center.
We treat our staff like family, and we function as a team. And with that, we want to include the patient as part of the family and the team. And I think that collaborative venture is what allows us to have patients like you that have a very good experience, a great outcome, and walk away from this with a smile on their face like they have right now.
Yes, I walked out of here right after surgery so happy.
Yeah.
I remember feeling like $1 million, and every day that goes by, that value just keeps going up and up
Yeah.
and up. And it's all thanks to Dr. Parker and the staff. I am so grateful. Even in my first follow-up appointment, as I shared, I was just so emotional on how happy I was when I was
emotional.
Oh, I guess I was just so happy.
You were
because
so happy.
I was genuinely so happy because I had not felt that way in so long, and I didn't even think it was possible, but it was possible thanks to you and your care and your facility. I can't thank you enough.
Well, my pleasure. And the reason I enjoy what I do so much is I enjoy the technical aspect of surgery. The artistry, being able to shape a body into a desirable form that we're shooting for. So that's really fun in the operating room. So I really enjoy that from a technical standpoint. But then equally, I enjoy being able to change someone's life, like you, and see the smile on their face then and now, and know that that craftsmanship that I performed in the operating room leads to such a beneficial thing in terms of your life and going forward. So that combination of things is why I really enjoy what I do and working with people like you.
One of the things I found fascinating was right before surgery, Dr. Parker took his time and marked my body. And the care and attention and detail that he was placing and notes that he was making, I just knew this is going to come out with amazing results. And sure enough, results. Yep. Sure did. But just that attention to detail was just so impressive. I knew the artistry was at work. So I was very, very happy to see that. And again, just another layer as to why I was so happy to have chosen to come back and get the procedure done here. So I just wanted to share that with everybody.
Yeah, well, thank you. I think good plastic surgeons who really take their craft seriously, as are many of us, are really have a high level OCD, because planning out the operation is so important. So when you get in the operating room, everything's kind of set to go, and you just kind of go through the various movements there to do things the way you want to do them, move the tissues the way you want, but you planned it out from the beginning.
So Karen, we just wanted to give you a book that Dr. Parker wrote, What to Expect After You're Done Expecting. It's a really, really good book with a lot of fun stuff in there. So there you go.
Can I have an autograph?
Absolutely. So we can, this book I wrote a couple of years ago, but it's pregnancy is such an interesting phenomenon for women and their families, and so many things change in the body, and so many questions raised that we thought it'd be fun to put this together and just kind of walk through pregnancy and what it does, the effect of pregnancy on the body, on the mind, and then at the back some various solutions for problems that can occur. So enjoy it.
Thank you.